Welcome back to In Focus, and it's time now for our In Focus health update. And of course, health reporter Linord Moudou joins us now with news on a doctor's strike in Nigeria and a report on the challenging work of nurses. Hi, Linord.
Hello, Dimiake. 788 doctors sacked in Lagos public hospitals recently went to court to challenge their dismissal by the Lagos state government. The doctors were fired for embarking on a 3-day warning strike over a lengthy salary dispute. The doctors went on strike to push their demands for the full implementation of the consolidated medical salary structure, which they say the government has agreed to. After the doctors were fired, the state government announced the recruitment of 373 new doctors to start work immediately. The chairman of the Medical Guild Association blames politics for the woes facing doctors and the health sector in Lagos.
The health system that has collapsed in Lagos is going to collapse nationwide. And these same politicians will not be able to do anything about it. They will take the next flight out of the country for treatment. But the masses can't do that. They can't afford to do that. Even if they know where to go to, they can't pay for it.
Dr. Olajide Idris with the Commission for Health of Lagos State says the doctor's dismissal was in accordance with the provisions of the civil service rules and that there was no going back.
It is not by force you work for Lagos State government. As you must know, I don't know of any state government that has presented and paid this amount of salaries to doctors in their various states. If there is any, there can be more than one or two. And those state governments do not have the workforce that we have. They do not have the challenges we have as a state in terms of population we need to treat.
We turn now to another workforce in the healthcare sector, nurses. I recently spoke to registered nurse Busime Mimy Mudekereza. She works at the emergency room at Columbia University Medical Center, and she trains nurses at Ijwi Island in the Democratic Republic of Congo through the Amani Global Works project. She talks about some of the challenges nurses are facing in rural area.
So the nurse is the one who gives the first comfort, who reassures the patient and direct the patient to the right doctor, to the right care, and just work through the whole process. I personally work in the emergency department, so I am the one who sees the patient at the door when they come in distress to seek care.
And we see nurses with doctors. It seems like it's a complementary relationship there. Tell us how the nurse supports the doctor.
In a general sense, I would say the nurse is more present with the patient, although it's very important for the doctor to come and assess and direct the care, but the nurse is the one who is constantly at the bedside with the patient, who see changes as they happen, whether to the better or worse, who alert the doctor whenever it's needed, and who is able to carry on doctor's order based on what diagnosis they've been able to find in order to help the patient.
Now, you work in the United States and in a hospital where you have all the equipment, all the means to care for the patient, but you have also worked in Africa as a nurse in Africa in a rural area. What do you see?
The nurse, especially in the rural area, is everything. You are the obstetrician, you are the dentist, you are the urologist, everything that comes out the door. You just have to act and do your best. I see myself as a very good emergency nurse here in the United States, but when I went back to Africa as I'm doing the training for our nurses, I was a little bit intimidated at some point because when I have a very critical patient coming at the door, I know I can call for help. But our nurses, specifically to the island where I've been working, there's no doctor to call for help. They are there and they have to do everything that needs to be done.
So what type of additional training you think that these women and men should receive?
Physiology. Most of their practice is based on experience. They've seen this work, then they keep doing it. They were not able to elaborate more on the rationale behind their action. Why are you giving this medication? It's even better if the nurse could understand the physiology beyond the symptom and the treatment, what are the side effects, what are the consequences, not only for now, the patient can be fine for now, but what about in 10 years?
You're training the women on the Ijwe Island. Tell us about the need of the nurses there.
First of all, we don't have enough nurses trained. There's no update on the current treatment available or research available, and there's no communication between nurses, even on the rural area. Like in Ijwe, our nurses have not much contact with the southern hospital, which is 18 hours walk. We should have like an association of nurses in rural area, and they should have a place where they can get more information readily available for them, depending on the situation that the situation they are dealing with on their daily practice.
Looking ahead, what would you like to see in terms of positive change for these nurses?
As I said again, nurses, they are everything. I would like the education system to train nurses at different levels, train on the job, or high school nurses, college level nurses, and even further. So at each level, there should be some recognition, a certificate, a degree, and with a set of skills that you know for sure. So I would like to see nursing education improved. I would like to see nursing education more recognized actually as well. I would not like to compare them to doctors, but they actually are most of the time the only clinician available. So their education and their value should be recognized for what it is.
And any final word? And that's all, Dimyake.
What an interesting interview. Thank you so much, Linord Moudou. And Linord Moudou joins us every Tuesday and Thursday, always has very informative health updates right here on In Focus.